Hey guys, welcome back to my channel. So I do have another opportunity for you to work from home. The name of this company is United Health Group. Okay, they're hiring for a customer service representative position. It's the customer service representative position for national remote. It's also located in Indianapolis, Indiana. It's the United States. If you do want to check and see what other jobs they're hiring for remotely, you can check in for external candidates. You can check here, and for internal employee applications, you can click here, okay? Just to kind of let you know that, because a lot of people don't always check there. All right, so let's talk more about this position and what you're going to be doing on this job, okay? So once again, this is United Healthcare, and they're hiring for customer service representatives. So as a specialty prior authorization coordinator is what you're going to be doing. Your role will be focusing on notifying a provider when a prior authorization is required for specialty patients with acute and chronic disease states. So, in this role, you're going to be preparing prior authorizations for submission. You're going to follow up on the prior authorization outcome, addressing issues, and handling concerns from other corresponding departments. All right, so for this position, it's full time, Monday through Friday. Employees are required to have flexibility to work any 8-hour shift scheduled between the normal hours of, which is business hours, 7 a.m. to 7 p.m. Central Standard Time. It may be necessary, given the business need, to work occasional overtime. Okay, so if you're someone that can't do that, I don't recommend you to apply. But if you're looking for work and you're trying to get that money, there you go, and there you have it. So they offer 3 weeks of paid training. The hours during training will be 9 a.m. to 5:30 p.m. Eastern Standard Time, and that's Monday through Friday. So the training will be conducted virtually from your home. So this here is what you need to know. All right, so you just need to be able to be someone that's going to enjoy the flexibility to telecommute. All right, some people can't sit at the computer. Some people don't like to be by themselves and they need all the other background noise on the jobs. Me, no, I don't need the brick and mortar. I'll come home to my own brick and mortar and my own space because I have to focus. All right, so if that's you, then apply for this job right here. Now, the primary responsibilities for you is initiating PA requests. So, the prior authorization, that's what that stands for. You're going to be validating insurance types like Medicaid, Medicare, and commercial insurance as well. You're going to be accessing multiple Optum resources to check prior authorization statuses and benefits. All right, so you're going to problem solve with decisiveness and urgency and escalate to operations partners. You're going to be talking to your team leads, management, and other stakeholders in this on the job. And then you're also going to just ensure patients and providers are supported by following escalation through to the finish. Okay. You're going to enter your notes. So you're going to do note takings. Every time you take a case, you just remember you have to take notes. All right. Jot down what happened on that call. Information into pharmacy processing systems is where you're going to be putting that information in. You're going to focus on patient care and quality assurance. All right. So you have to make sure you're doing your job right when you're dealing with the healthcare field. Okay, guys? Because you don't want to get audited on your claims and your cases. You're going to have to focus on patient care and quality assurance. You're going to have to be able to work flexible hours between 7 to 7 p.m. Central Standard Time, Monday through Friday, once again. And then you're going to maintain strict confidentiality and adhere to all privacy and security regulations when handling sensitive information. Because remember, this is a healthcare field, and if you know anything about HIPAA law, you will get sued if you violate that privacy. Okay, guys? So you have to be very careful. All right. So you're going to be rewarded for your job, okay? And they're going to recognize you for your performances in this environment, okay? Especially because this job can be challenging a little bit. But once you learn the training, it's not too hard. But you deal with different people, calling in patients, calling in about different things and providers and all that good stuff. So it is what it is. So required qualifications is you need a high school diploma or GED equivalent work experience equivalent. You need 1 year of customer service or healthcare industry experience. You need Microsoft Office proficiency, Microsoft Word, Excel, and Outlook. You need the ability to work independently. So that's what I was talking about. If you're someone that needs to be around people all day, you can't stand on your own, you need a little bit more support because you just don't like that quietness, then this won't be the job for you. Okay? You must be 18 years of age or older, ability to work any 8-hour shift. That's kind of what they're kind of letting you know. They're pushing that. They need you to know that you're going to be working on this job, okay? This is the healthcare field. The healthcare field is always busy. All right, so once again, preferred qualifications, not required. prior authorization experience in pharmacy or healthcare. So that's a plus for them, okay? Now, telecommuting requirements are thus you must live in a location that can receive a United Healthcare Group approved high speed internet connection or leverage an existing high speed internet service. Required to have a dedicated work area established that is separated from other living areas and provides information privacy. Ability to keep all company sensitive documents secure. So, what they mean by that, that's why I kind of let you know, guys, and I kind of reiterate on that fact and put more emphasis on the fact that you need a room with a door because privacy is very important, okay, when it comes to dealing with PII, important information and documents and things like that. All right. And so soft skills, you need ability to manage multiple tasks and set priorities. So with healthcare programs, they have a lot of systems that you have to navigate. So you need to be someone that's able to multitask, okay? Ability to establish and execute action plans, able to share your past successes as well. Ability to diplomat or be diplomatic when faced with conflict and always communicate in a professional and courteous manner. Ability to produce quality results with a detailed oriented focus. All right. General knowledge of pharmacy laws, practices, and procedures. You need that understanding. Knowledge of insurance and third party billing systems. So I tell you like this, you can do it. You just have to take time and do a lot of reading because it's a lot of reading and understanding. And sometimes you don't feel like you have the time or the day with whatever's going on in your life when you already have a hectic life schedule. But if you can do it, if this is something you're interested in, there you go. Some people love challenges, so this would be one. All right. So all telecommuters will be required to adhere to United Health Group's telecommuter policy. So California, Colorado, Connecticut, Hawaii, Nevada, New Jersey, New York, Washington, Rhode Island, or Washington, D.C. residents only. The hourly range for this is $16 to $28.27 per hour. Pay is based on several factors, including but not limited to local labor markets, education, work experience, certifications. I like to read that, guys, because a lot of times we skip past that and be like, wait, hold up, why are they getting paid more than us? People live in different states. The cost of living is different and it's more, which I just kind of figured that if they're paying $28 an hour at a job, I feel like no matter what my minimum wage is or what our cost of living is, I still want that $28.27. I don't know why they just don't do it like that, especially if you're someone who already has a lot of experience. I feel like you've met that amount already, okay? Probably really exceeded it if you've been in it for like 20 years. All right. So anyhow and anywho, the application deadline, this will be posted for a minimum of 2 business days or until a sufficient candidate pool has been collected. That's why I always let you guys know, even though it may say the deadline is September the 25th, you still want to check on that link. Click on that link and check and see if that posting is still up because you may have a chance to slide on in there or get on in there and become a part of that pool and get, chosen for the job because sometimes they haven't found, someone who is sufficient and able to work the job, or maybe somebody got chosen and they had to quit, so many different reasons. All right, so there you go, and there you have it. You'll click here to apply for the job. Thank you so much for tuning in. Like, share, and subscribe, and bye for now.